And joining us now for medical analysis is Dr. Ingrid Skop, Senior Fellow and Director of Medical Affairs at the Charlotte Lozier Institute. Dr. Skop, as someone who has dedicated your life's work to bringing life into the world, I first just want to hear what your immediate reaction was to this devastating news.
When I initially looked at the photographs and the videos, my initial reaction was sadness. These babies were big and they were clearly viable. They could have lived separated from their mothers. They looked like normal children that I deliver every day in my practice.
Could you tell us how specifically you determined that these babies could have been victims of infanticide or of partial birth abortions?
Well, one of the babies, a little female, the initial picture that looked at her face showed very little cranium. It looked as if she might have anencephaly. But a photograph from the back showed a surgical incision into the back of her brain. This is consistent with a procedure that is illegal by federal law. A layman's term is partial birth abortion. The medical term is intact dilation and evacuation. What happens is the baby is delivered feet first to the level of her head, and then an incision is made in the skull. The brain tissue is vacuumed out, and then the skull can be collapsed and delivered. There was a large male who looked as if he had no visible abnormality or surgical incisions. My concern with this child is that he was probably delivered by an induction abortion. And if he was not killed prior to the abortion, generally that's done with a needle injection into the heart or into the amniotic sac with digoxin or some other poison that will stop the heartbeat. If he was not killed in advance of the abortion, it is highly likely that he survived the abortion, was born alive, and then was allowed to die by neglect.
And based on what you found, is it certain that these babies could have survived outside the womb had they been given proper care or a chance to live?
The size of the babies is consistent with probably several weeks, maybe even several months past the point of viability, which is where we expect a baby to survive. There were no obvious abnormalities that would make us think these children were killed because they could not survive. So I think that there is a high likelihood that had they been treated as we should treat unborn children with care, that they could have survived, either gone to term and lived, or even lived at the gestational ages in which they were delivered.
And Dr. Skop, we have just a few moments left. Pro-life groups are calling for the DC medical examiner to autopsy the bodies so we can know exactly how these children have been treated. From a medical perspective, can you share why this absolutely must happen?
There are very few limitations on abortion in our country. Most people are unaware of that. But even so, there are some limitations, and for abortionists to flagrantly violate the law in order to kill children that are capable of feeling pain, generally these late abortions are for the same elective reasons as early abortions. This is analysis and possible prosecution is crucial for the ethical well-being of our society. We cannot allow people to kill these babies wantonly without regard for the law.
Could not agree more. Dr. Ingrid Skop, thank you for looking so closely at this situation from the Charlotte Lozier Institute.
Thank you, Prudence.